We warmly welcome you to this pivotal side event during this Devolution Conference 2025 in Homa Bay County. This session aims to provide a comprehensive understanding of public-private collaborations and importantly co-create innovative financing and governance structures that will sustain Kenya's health sector under devolved governance.
This is not charity, it is a shared value. A healthy population is the foundation for a thriving economy and a productive workforce. I stand here not just as the governor of Homa Bay, but as a daughter of this region and as a zero malaria champion for the Lake region. I call on our fellow leaders, our development partners, the private sector and our communities. Let us keep our foot on the pedal. Let us ensure that the next generation inherits a Kenya where malaria is not a daily threat, but a story of the past.
I want us to discuss how locally driven innovations and investments can complement foreign catalytic funding and investments to power our health system. Rather than lamenting over limited treasury resources and growing healthcare needs, I want us to figure out how to plug budget deficits through partnerships. And rather than competing over limited resources and opportunities, I want us to cooperate better and build more opportunities for co-investment and mutual growth. At the end of this event, I would want to see a commitment from this congregation to work together towards making healthcare partnerships a reality at the national and the county level. Ladies and gentlemen, let us have a Homa Bay statement, a show of resolve and commitment to establish a joint learning mechanism to build experience and expertise among counties to engage in PPPs.
When equity is the guiding principles, PPP becomes not just partnerships for infrastructure, but partnerships for justice. Let us move forward with a shared commitment, start small, learn fast, scale smart, and above all, keep the citizen at the center. Together we can build a healthcare system where every Kenyan in every county has access to quality, equitable, and inclusive healthcare.
The earlier speakers have spoken about the donor funding shrinking, and we can leverage private-public partnership to have a health system that is resilient, responsive, equitable, and sustainable.
I can see that we are really going to continue improving, and we recommend to our colleagues and other county leadership that most likely this is the way to go, especially with the dwindling resources which do not show any sign of expanding. At our hospital, we get referrals from the surrounding counties, and some of the tests that we could not be able to do, the test menu has rapidly increased.
We must adapt, and one way of adapting is exactly what we are doing here today, fostering public-private collaborations that make sense, okay? And just by looking at the partners in the house tonight, I know for a fact that we have exactly what it takes and exactly who it takes to deliver us to Canaan.
The distinction that it is private and public is just because of management and the source of funding and a little motivation of interest in the part of the private sector. That money in the health sector, we need to put it all together, whether it is in the public sector, whether it is in the private sector, and how can we best use it. If you do that, we actually have enough money.
What I would like to say is maybe we still need to have a lot of conversations between private sector and the executive, because we think we in Parliament has provided the legal framework for private sector and public to work. That's why we have a PPP Act in place, we have a Social Health Insurance Act in place that can pay for services used by the public both in public and private facilities. The conversation should be at the implementation level. What is it that the executive in the county and at the national government level can do with the private sector in terms of implementation and collaborate?
So today's event has been very useful. Firstly, because it has been a good opportunity to network, but more importantly, moving forward to support implementation, to improve the quality of service delivery, we must take care of financing. I think that private-public collaboration is the way to go in the health sector. Indeed, in the public sector, there are not enough resources. There are not enough new ideas. There's not enough innovation. Partners are our lifeline. And as the public sector shrinks, it becomes even more important that we begin to work with the private sector.
What I've learned, especially from the chair of the Health Committee in the National Assembly, is that it's not just about partnerships at the local level. So in Nakuru, between me and a private organization X. It's also between counties, intra-county, between us in Nakuru and Nyandarua and Kiambu like that, but also with the national government and with the international organizations.
Today's session was particularly very interesting for me to learn about the initiatives that counties have embarked on. With fairly limited resources, they're doing amazing work, and it's important that we find mechanisms to showcase this more often for them to learn from each other. PPPs, especially when you are looking at them, you need to think about the outcomes for the people that you're trying to serve. So through this partnership, you can ensure that you reach in a measurable way to people that previously didn't have these services before. And then it begins to make sense for the whole population.
Our health system from its inception has been a partnership. The players in that space has always been that mix of private and public. And many services and big national challenges like immunization or HIV or COVID have always required that each of the players puts their best foot forward. So the need to make sure that whatever deals are entered into can stand the test of time, the test of regime change, and each party keeps their part of the bargain, and when there is a dispute, that dispute can easily be resolved because the laws are clear and the judicial processes or the conflict resolution mechanisms work quickly.
The Homa Bay statement is a statement of intent to strengthen peer learning, counties learning from each other, counties growing each other's ideas, and counties avoiding mistakes that other counties have done and picking on the successes. So picking successes and avoiding mistakes. So we can leapfrog a lot of mistakes, we can leapfrog a lot of inefficiencies through a joint learning mechanism that brings all these lessons together.